who have a family history of diabetes, you get them 2 hours post-prandial blood sugar. That means you give 75 milligrams of glucose to such individuals. After 2 hours, you see his blood sugar. If the blood glucose is borderline between 130 to 140, we call it as the glucose intolerance. He has not developed diabetes. There is a possibility of diabetes. So therefore, it is earliest phase of detection of the diabetes, and we advise them to monitor their lifestyle. By monitoring the lifestyle alone will prevent the manifestation of diabetes in future. What is lifestyle management? I will come to I will speak to later. So therefore, the patient who has already established diabetes, that means his fasting blood sugar is more than 120, his PPBS, postprandial blood sugar, is already more than 200, and his HbA1c is already more than 7 and 8, then we call it as an established diabetes. Friends, most of the people have gotten a belief that checking a blood sugar once in a blue moon will help us to know the control of diabetes or the diagnosis of diabetes. No. Remember, the blood sugar level varies second to second. See, the blood sugar level depends upon many factors, not only insulin. So there is another hormone called glucagon, which will increase the glucose level. There are so many other hormones like growth hormone, adrenal corticosteroid hormone. All these will influence the glucose metabolism. So therefore, just because there is monitoring the glucose level is very important, and so many factors, since there are so many factors influences the level of the glucose thing. So just by one stretch of examination, you cannot diagnose diabetes. So diabetes, fasting blood sugar, 12 hours preceding fast. Then you take the blood, examine the glucose. Blood sugar means not this sugarcane sugar, it is glucose. So the terminology itself is wrong. It should be called as blood glucose, not sugar, because sugar is a different combination. So therefore, blood glucose level, if it is fasting blood glucose level is more than 140, definitely it confirms the diagnosis of diabetes. If it is more than 200 ppbs after 2.5 hours of food. And now, as I said, the blood glucose varies from second to second depending upon your mental status, depending upon what food you have taken, depending upon what physical activity